If you lift, eat low carb or carnivore like me, and you've ever opened your medical lab portal like it's a horror movie trailer, this one's for you. Because today we're talking about creatinine confusion, especially for lifters, low carbers, and anyone taking creatine who suddenly sees a lab value that looks off and starts planning their kidney funeral. And I want to start with my own journey, because this video exists for a reason. I've done 2 videos about creatine already. The first one was basically, is creatine safe? A doctor's recommendation. I did the deep dive. I looked at the data and realized creatine has a lot more upside than most people think. That research is what inspired me to run my own experiment. So I took creatine for 90 days and then made a second video. The unexpected creatine side effect the doctor noticed after 90 days. And despite how the title sounds and the side effects I described in that video, I decided to keep taking creatine. But I also know that creatine can influence creatinine. And creatinine is the lab that has terrified low-carb people for years. So even though today's video is not really about creatine, creatine is part of the reason we're here. Because I want you to feel confident trying it, if you decide it's right for you, without letting a single lab number bully you out of a good decision. And I'll be honest, before I spent time in the low-carb community and learned how these labs behave in real humans eating real food, creatinine used to make me nervous too. A lot of conventional clinicians see a higher creatinine and automatically think kidney disease. But when you're low carb, when you lift, when you're more muscular, when you're eating more protein than the average bagel-based citizen, you are not a standard reference range person. You live in a different metabolic neighborhood. So we have to interpret labs through the right lens, not a fear lens, a physiology lens. Now, quick disclaimer, this is education, not personalized medical advice. Use this to have better conversations with your clinician, not to start diagnosing yourself at 1 a.m. with the help of an online forum and a flashlight. All right, here's the big idea. Creatinine is not a kidney toxin. Creatinine is a byproduct of creatine metabolism, mostly from your muscles. So creatinine can rise for 2 broad reasons. Number 1, you're making more creatinine. Number 2, you're clearing less creatinine. And those are very different stories. Think of creatinine like smoke. Smoke could mean your house is on fire, or it could mean you're grilling ribeyes like a responsible adult. Same smoke, very different situation. So let's break it down. So why does creatinine go up in healthy low-carb lifters? If you have more muscle, you generally generate more creatinine. If you train hard, especially heavy lifting, sprints, intense endurance, your creatinine can bump up temporarily. If you're a little dehydrated, your blood becomes more concentrated and creatinine can look higher. If you eat a big meal before your labs, creatinine can trend up. And yes, creatine supplementation can increase creatinine because you have more substrate that can eventually convert. That's not automatically kidney damage. That's chemistry. So if you're low carb, lifting, taking creatine, and your creatinine is mildly elevated, that might be a normal artifact of a high-functioning body doing high-functioning things. But here's where it gets tricky. Doctors often don't just look at creatinine. They calculate something called the estimated glomerular filtration rate, which is an estimate of kidney filtration. The problem is most GFR formulas assume a typical muscle mass and typical creatinine production. So if you're more muscular than average, your creatinine can be higher even with normal kidney function, and the estimated GFR can look falsely low. It's like trying to estimate the size of a truck by looking at tire marks and then getting alarmed because the tire marks belong to a truck, not a tricycle. So the question is never, is creatinine high? The question is, what's driving it? And what else do we see with it? Now let's make this practical. If you see creatinine is up, ask, did I train hard in the 24 to 72 hours before the lab? Was it heavy legs or a brutal workout? Did I fast and underhydrate? Did I do low carb and forget electrolytes? Did I start creatine? Did I eat a lot of meat right before the test? If the answer is yes to a few of those, you may be in the more production bucket and not the kidneys failing bucket. Now let's talk about when creatinine is more concerning. Clues it might be more than muscle. If creatinine is rising consistently over time on repeated labs, if GFR keeps dropping in a consistent pattern, if you also have abnormal urine findings, especially protein or albumin, if you have uncontrolled blood pressure, if you have diabetes or long-standing insulin resistance, if you're noticing swelling, foamy urine, shortness of breath, or persistent fatigue. If your potassium or bicarbonate is abnormal in a concerning pattern, those are the moments to take it seriously, because the root causes of chronic kidney disease aren't usually protein or creatine. They're typically metabolic dysfunction, diabetes, hypertension, vascular disease, chronic inflammation, medication burden. In other words, kidney disease usually doesn't start in the gym or at the steakhouse. It usually starts upstream in the metabolism. And that's exactly why low carb and lifestyle change can be powerful, because they address the upstream problem. Now, here's the lab tool that removes a huge amount of confusion. Cystatin C, the muscle-proof kidney clue. Cystatin C is produced by many cells in the body at a fairly steady rate and filtered by the kidneys, and it is much less influenced by muscle mass than creatinine. So in muscular people, athletes, or low-carb carnivore folks with higher protein intake, cystatin C can offer a clearer picture of kidney function. Even better, some clinicians use creatinine glomerular filtration rate, cystatin C glomerular filtration rate, and sometimes a combined equation. That combination can be extremely helpful when creatinine is muddy. So if you're a lifter, a muscular person, or someone taking creatine and your creatinine is elevated, a very reasonable question to ask is, can we check cystatin C for clarity? And if you think about it, C for clarity is a nice way to remember the test. Now let's talk about a second tool people ignore, urine testing. If you want early clues of kidney stress, don't just stare at creatinine like it's a crystal ball. Look at the urine, the big ones. A basic urinalysis, urine albumin to creatinine ratio, sometimes protein to creatinine ratio. Why does this matter? Because early kidney damage, especially in diabetes and hypertension, often shows up as a albumin leakage before creatinine shifts dramatically. So if your creatinine is mildly high, but cystatin C looks good and your urine albumin is normal, that's a very different story than kidney failure. So let's address the low carb angle. When you go low carb, insulin drops. When insulin drops, the kidneys excrete more sodium and water. That's why some people lose water weight early and may feel dizzy, tired, or crampy. If you don't replace fluids and electrolytes, dehydration can temporarily concentrate your creatinine and make kidney numbers look worse than they are. So sometimes the fix isn't fear. It's hydration, electrolytes, and smarter timing of labs. And please, hydrate earlier in the day. Don't be chugging water at 9 p.m. and then waking up every hour like your bladder joined a marching band. Hydrate earlier, taper later. Now, what about creatine specifically? Creatine can increase measured creatinine because of increased conversion. That doesn't automatically equal damage. But if you have known kidney disease, are on high-risk medications, or have concerning symptoms, that's when you monitor more closely and talk with your clinician. Again, trends and context, not one number. So here's your do labs like a pro checklist, especially if you're a low-carb carnivore, lifting, or taking creatine. Lab checklist to reduce false alarms. Avoid a brutal workout for 48 hours before labs. Stay normally hydrated the day before and the morning of the test. Keep your diet consistent. Don't do a random meat marathon the night before if that's not your usual. Tell your clinician if you're taking creatine. Consider adding cystatin C for clarity. Ask for a urine albumin to creatinine ratio if it hasn't been checked. And most importantly, don't interpret creatinine in isolation. Now let me speak to the heart of this, because I know how people feel. I've watched too many people get excited about low carb or carnivore, start feeling better, losing fat, improving glucose, lowering blood pressure, and then one high creatinine scares them right back into the old habits. And that's tragic. Not because creatinine doesn't matter, but because fear without understanding makes people abandon what's healing them. So here's the bottom line. Creatinine is not the villain. Creatinine is a clue. In lifters and low-carb eaters, it often reflects muscle mass, training, hydration status, diet, or creatine supplementation. But it can also reflect true kidney issues, especially when it rises over time and is paired with abnormal urine findings, uncontrolled blood pressure, or metabolic disease. So the fear goes away when you stop asking, is this number bad? And you start asking, what's the metabolism behind this number in my body? That's the root cause lens. And it turns anxiety into a plan. And if this helped, hit like and subscribe and share this with a friend. And if you want more content on metabolic health, low carb, and how to interpret labs without panic, click the playlist and check the links in the description for more videos. Now, tell me in the comments, have you ever had a creatinine panic moment? And what did you learn? Because nothing builds community like shared lab trauma. and better physiology the next time.